Lamellar ichthyosis. It is a type of autosomal recessive ichthyosis, and there is a defect in gene encoding for transglutaminase. Lamellar ichthyosis is a very rare disease that presents at birth. It is seen equally in both males and females. The newborn usually presents as a collodion baby, unsheathed in a lacquered membrane. When the membrane sheds, typical scales become apparent. The scales are large, thick, rigid, plate-like brown, adherent, which may shed intermittently, revealing erythematous patches. But the condition persists for life. Erythema is minimal or absent, but when present, it is more conspicuous on the face. The lesions are usually generalized and is more on lower extremities and flexures. The image shows the collodion membrane. Here we can see the characteristic large, thick, adherent scales of lamellar ichthyosis. Lamellar ichthyosis is associated with features like ectropion, aclabium, crumpled ears, palmoplantar keratoderma, and heat intolerance due to impaired sweating. The image shows severe ectropion in a baby with lamellar ichthyosis. The points to diagnosis are: history of collodion membrane at birth, characteristic large, thick, brown, adherent scales especially on shins, minimal erythema except on face, and presence of other associated features like ectropion, aclabium, crumpled ears and palmoplantar keratoderma. Treatment requires genetic counseling, and mild disease can be managed with hydration, emollients or moisturizers and keratoaetics similar to ichthyosis vulgaris, and severe cases are treated with acitretin under careful supervision. Thank you for watching. If you like the video, please feel free to like and share and subscribe to our channel for more videos.